I'm taken by surprise how much attention we're getting with the pregnancy passport, and suddenly, um, um, it's creating a lot of noise, and it's amazing. It's amazing because the passport, as you can see, allows a woman to take care of herself. Like, she takes care of her own health, is in her hand, and then she puts down her information, and she takes charge of what she needs to do to improve her own health. And I'm afraid there's no shortcut to good health.
Welcome to another episode of the Motherhood Clinic podcast. We're very happy to have Professor Liona Poon join us today. She's a professor of obstetrics and gynecology with an academic subspecialist in maternal fetal medicine at the Chinese University of Hong Kong. And she's a visiting professor at the Department of Women and Children's Health at King's College London in the UK. She also serves as a visiting professor for several other universities worldwide. She's internationally recognised for her dedication to improving maternal and fetal health and has an extensive research portfolio with over 300 peer-reviewed publications in high-impact factor journals and an H-index of 73. For the past 20 years, Professor Poon has focused on developing strategies for the early prediction and prevention of preeclampsia. It's one of the leading causes of maternal and perinatal morbidity and mortality. Her pioneering work includes developing a first trimester prediction model that combines maternal risk factors, ultrasound, blood pressure, and biochemical markers, and establishing aspirin prophylaxis as a preventative measure. Her vision extends beyond obstetric care to transform women's health globally through clinical research, education, and advocacy, ensuring that early screening and prevention becomes standard practice across the continuum of care. Professor Poon remains dedicated to improving outcomes for women and babies, driving innovation that shapes policy and practice worldwide. This is a follow-up episode, and this time we're looking more around solutions. And Liona mentioned this before, but the FIGO Pregnancy Passport, so the International Federation for Gynecology and Obstetrics, which is a best practice-based guidance. And I think our focus is more on like self-care for women, empowerment and accountability. And what we're trying to see is how can we make women feel confident in optimizing their health? How can we help them build habits to protect them in the long term? And what we could do as both clinicians, partners, families to support this. So the first question is, what is the FIGO Pregnancy Passport? Could you tell us a little bit more?
So let me take you through the pregnancy passport. And basically, we developed this as a side product of our best practice advice for optimizing future cardiovascular health. We wrote this best practice advice, and then suddenly we recognize the importance of written information. I don't know whether you remember after giving birth and with your crying baby, and then imagine the midwife was just telling you a lot of stuff. I don't know how much you could retain. Certainly, I can imagine that, nothing. So imagine I've had preeclampsia. I've had a tough delivery or cesarean section. I have a crying baby next to me, and suddenly I have this midwife telling me to breastfeed. One ear, breastfeed, breastfeed, breastfeed. Next ear on the right. Okay, having had preeclampsia, okay, your next pregnancy, you're also at risk of preeclampsia. You have to do X, Y, and Z to prevent this risk, etc., etc. So I don't know how much a woman can retain. Yes, recognizing this. And so within our best practice advice, we wrote a little sentence as a best practice guidance that we should provide written information with regard to the impact of having had a hypertensive complication of pregnancy on subsequent pregnancy and future health. So this is why the pregnancy passport came about, because we recognize the need of written information. And at that time, when I was leading this project within the FIGO Impact of Pregnancy on Long-Term Health Committee, and then there was another member, and then he was telling us about this passport that he created. He's from Canada, and his name is Professor Graham Smith. And then so we're forever grateful to his work, because he was the one who told us about this little passport that he created as part of his clinic for postnatal management, a much smaller passport that can go into a wallet, 3 sides, but then we basically created the passport based on his version, but with more information. So it's we see it as a practical toolkit. We designed it so to help women stay healthy after childbirth, and it's a booklet, as you can see. There are 4 sides, and you can print it on an A4 piece of paper and fold it in half. So here you can see the first page. I would encourage that the woman fills out the form herself with our support, with our guidance. So, because that motion of the woman filling out the form herself, it empowers her to take care of her own health. So she writes her name, her date of birth, and on the top right, she writes down the details of her baby. And then the bottom half, you can see that we ask her to fill out her background information, whether there's a family history of hypertension, etc. And then the second page, we ask if a woman has had any complication during pregnancy. We tell the woman that if there's any check in any of these boxes, then unfortunately she's at risk of future health issues, as shown in the bottom of the second page. Much higher risk of renal problems, stroke, diabetes, etc. Yes, we scare the woman, but on the third page, we tell the woman that actually there's something we can do to reduce her risk of future complications: eating well, living a smoke-free life, breastfeed as long as possible, sleep up to 6 hours, etc. And then we also advise the woman to undergo some health checkups, as shown in the bottom right of the third page. So in fact, the last page is a table. This is where the woman needs to document her data, her numbers. And then you see that, yes, upon discharge, she needs to write down her blood pressure, her weight, her body mass index and waist circumference. And at 6 weeks postpartum, 3 months postpartum, 6 months and 12 months postpartum, then she's meant to also record a number of her own parameters. And why these visits? Actually, these visits coincide with the newborn checks, either with newborn checks or vaccination. And so what we wrote in the best practice advice is that, mother-baby visit will be fantastic. I think that's a opportune moment for us to also check on the woman. And this table looks a bit complicated, I'm afraid. And so essentially all the white boxes are essential. The green boxes are optional, depending on resources being available. So, but certainly I think checking the hemoglobin, checking whether a woman is anemic is important. If a woman has had diabetes on top of preeclampsia, then certainly we would like to recommend evaluation of the HbA1c, is just a sugar level that reflects the sugar level over the past 3 months, glucose tolerance test as well. And then if a woman has had abnormal kidney functions, then we obviously advise for a repeat of that. And in the bottom of the 4th page, and some little guidance, a little bit of guidance. High blood pressure, of course, the woman should see her doctor. If she's overweight and there's a need to adopt a healthy diet, go back to the best body weight. And then you've noticed that we're not talking about anything else other than the best body weight, because the best body weight of every woman would be different. Your body weight will be different from mine. And so I think it's hard to imagine what it means. So I kind of go back to the pre-pregnancy weight and see whether it's feasible. Often it's not, because it's like 10 to 15 kilos difference. And it's extremely daunting for the woman to think about that. I need to go back to my pre-pregnancy weight. And how could she lose 15 kilos in the next month or so? It's quite impossible. So I think it's important to set achievable targets, achievable milestones, because if the targets are too far-fetched, and it's very discouraging. So this pregnancy passport is, I think, very, very helpful. Puts everything in one document, and also it creates a very good link between hospital care to community care. I'm sure it's the same problem in the UK, whereby the woman is discharged. Yes, there's a discharge summary to the GP, but often it's very light touch in the discharge summary, right? But here in this document, you can see, I mean, we've designed this with a lot of content, but then we've checked the content with some patient groups, and then they recognize that actually the information provided is just right. So that's reassuring. But at the same time, I'm thinking, nowadays. There's a big push for digital health. So I've actually created this into an app. And yes, it's free of charge for everybody to use, and feel free, and you're welcome to give me feedback and see how else, what else we need to include. And certainly I'm already getting feedback as to how we can improve. The printout one is in 12 different languages. So, and then the app itself, I have it in English and Chinese at the moment.
That's great.
So
And
yes, this is the pregnancy passport, and I think it has the. I mean, I'm taken by surprise how much attention we're getting with the pregnancy passport, and suddenly, um, um, it's creating a lot of noise, and it's amazing. It's amazing because the passport, as you can see, allows a woman to take care of herself. Like, she takes care of her own health is in her hand, and then she puts down her information, and she takes charge of what she needs to do to improve her own health. And I'm afraid there's no shortcut to good health. I know I also want that. I would like to suddenly lose 10 kilos or something like that, but then there is no other way but to really focus on one.
I think,
Yeah.
no, I think it's so important because I really do feel like there's the physical filling in. It really empowers women. And especially through COVID, we started to do a lot of home blood pressure monitoring for women. And women have reported that they really like it because then they feel they understand their health a bit more, and they know when to seek help when the readings start to go up a bit more. So just that sort of taking ownership and empowerment of self-care, and to continue that, I think is an amazing initiative. In terms of the lifestyle interventions that you recommend, like to try to optimize their health, is there a lot of around that to try to reduce the risks in the future, or still at its infancy in terms of the outcomes associated with these lifestyle interventions?
Very good question. And I think it's still in infancy, sadly. And what I'm seeing is that perhaps we are too impatient, and therefore we're not patient enough to really wait to see um, the desired outcome. But at the same time, I'm actually thinking of the fact that perhaps we have unrealistic expectations of what exercise could do and what a healthy diet could do. But then, so what we are, what at least within our implementation study, what we're aiming for is to demonstrate that the body weight stops going up. I'm not talking about, because as I mentioned in the previous episode, that for women with a complicated pregnancy during the first year postpartum, body weight goes up. I just want the body weight to remain static, and then perhaps figure out what else we can do to bring the body weight down. Because if you can imagine, if I can halt the worsening of rising body weight, this is already a win, right? And then another issue is, what I didn't say in the last episode, is that alongside the rising body weight, we're also seeing the rising blood pressure. Because I'm sure you remember that first visit postpartum 6 weeks, and you get that normalization of blood pressure. And we start seeing these women, and in my data, we're seeing that, yes, the body weight comes down at 6 weeks postpartum, and further down at 6 months, and then goes back up. And so by 1 year postpartum, the body weight is above the pre-pregnancy blood pressure. So you get that expected dip, and then blood pressure creeps back up by 1 year postpartum to above pre-pregnancy level. So another point is that I would like to see the body weight plateauing. I would like to see the blood pressure plateauing. The third thing I want to see is that we are able to increase the percentage of sustained breastfeeding before 6 months. I think that's another target that could be achievable. So if I set out to do a trial to evaluate whether exercise could reduce body weight, etc., perhaps we're not being realistic enough. So,
Is there a lot of evidence around the breastfeeding for more than 6 months in terms of optimizing outcomes for mothers?
yes, we don't talk about it enough. It's shocking because we only talk about the benefits for the baby, right? The bonding and the benefits for the baby, the protection. And we've seen some very convincing data, millions of postnatal women breastfeeding for more than 6 months. And naturally, you get a reduction in blood pressure. And then the something called Framingham risk score. There's a risk score for predicting future cardiovascular risk that comes down as well if you breastfeed for more than 6 months, and that's for cardiovascular health. And actually, sustained breastfeeding can also reduce all cancer risk for the woman.
That's really interesting. I think a lot of people aren't aware of that. So
Yes,
I know there's a
and
lot of rationale behind the recommendations in the FIGO Pregnancy Passport. Um, Thanks so much. It's a bit of a sensitive topic in terms of trying to get into the best physical weight, but I do wonder whether this area, when we know what the health benefits can be, but also I think women often are trying. I know it was a real struggle going through pregnancy and gaining weight in between pregnancies, but I do wonder if there is enough support there, and that's an area that we should really focus on. Like you say, there isn't that much nutritional support postnatally about what we should eat. I think we cover some of this outside of in this motherhood podcast, but in different cultures, there's very specific foods that you're meant to eat to help recover and rebuild and gain. But then I think we do neglect that sort of support from a nutritional and exercise perspective in terms of what can help women get to that stage of getting their best physical weight. So going to try to close this round because it's been amazing to have you on the podcast, Liona. But wondering from your point of view, what are your aspirations and hopes for the future for postnatal care and FIGO Pregnancy Passport? I know you've alluded to some of this already, but what would your final thoughts be?
So I think really there's a need for us to think about transforming this critical period into a proactive health journey for every mother. And then the first thing I can think about is the provision of a holistic care package, an all-rounded, comprehensive, holistic care package. Sorry. So just bringing all the right people to the table. I mean, it sounds very expensive. I know it sounds so expensive, but then, as you said, it takes a village to raise a kid. It takes a village to take care of postnatal woman as well. And I think, okay, the village can take care of them both. So I think we need to have obviously us, obstetricians, but then we have limitations as to what we can do in the community. So we need to engage with GP, family medicine doctors, and if necessary, of course, cardiologists, endocrinologists, for the respective complications, and dietitians, physical therapists, and then obviously very challenging to support lactation consultants. And I think having this multidisciplinary approach would certainly be able to support the woman to recover healthily, emotionally. I mean, honestly, is that the emotional side as well we cannot neglect. I'm thinking we have to also embrace innovation. As I've been embracing innovation and creating the Pregnancy Passport app. And I know that at the beginning we're thinking, oh, with limited funding, a printout is the way forward. However, I think having app, it seems to be the way forward. But at the same time, I'm really hoping that my app could be upgraded in the next version, whereby we could be linking the app with wearable devices or even the Apple Health app, just so that the app could remind the woman to get up, move around, to ensure she's sleeping well, so we can document the sleep health, etc., etc. So maybe even with some tips and tricks for sustained breastfeeding. And I think these are the two things that I can immediately think of. Yep. Providing holistic care model and embracing innovation, and hopefully together then we can really support the family to have a good experience postnatally.
Music to my ears. Yes. Thank you so much, Liona. And we will have some of the links at the bottom just to everything that Liona has referenced. Thank you.
Thank you very much for having me.